Thank you so much. Okay, so now we are recording. Okay, thank you so much for being here. Can you hear me? Give me a thumbs up. Thank you. So good morning, everyone. Today is our last day of advocacy days and today the subject is healthcare. My name is Gabriela Lewis. I am the co-chair for the DDC, Developmental Disability Council, and also the executive director for Hispanic Disability Support of Southwest Washington. Today I have black hair. Sometimes you will see me with a headset. I'm having some issues with my sound, with my computer, and I'm wearing a black shirt. It's great to be here with you all. Thank you for being here with us. And I'm here with Ivanova Smith. She's a great friend and advocate for people with disabilities. And Ivanova, would you like to introduce yourself? And before I do that, if you haven't chosen your language of preference to listen to this session, please select the language in the interpretation icon, and you will have the option for Spanish or English. Si no ha seleccionado la opción de interpretación y no está escuchando al intérprete, por favor, seleccione en el globito de interpretación español o inglés, o si está en un dispositivo, presiona los 3 puntitos y ahí le da la opción de los lenguajes para que pueda escuchar esta presentación en su lenguaje. Muchas gracias y que tengan una excelente sesión y pues aquí vamos. Welcome, Ivanova. Would you like to introduce yourself?
Hello, I'm Ivanova Smith, the co-MC with Gabriela, who's been amazing to work with. And I'm from South Advocates and Leadership Sale. And I'm passionate about this advocacy day, making so that we have healthcare and talking about healthcare needs for people with disabilities. Very excited to be here today.
Thank you, Ivanova. And today we are going to start with North Star. If I'm going to ask if you're not presenting to please mute your microphones so we can pay full attention to our presenters. And we are going to start this morning with North Star Healthcare Services co-facilitators Julie Clark and Doreen Vandervoort. And we are gonna listen to all our presenters, and the questions, we are gonna type them in the chat. So from there we can read them at the end of the presentation. So all our presenters have the opportunity to share.
My name is Julie Clark, and I am using my Toby Jamba box, a speech device, to share my message about health care. These are my own words, and my speech device will help me get them out clearly. I am bipolar and have cerebral palsy. It is hard having bipolar because I have to take my medicine at a specific time every day. If I want to see my counselor, I pay out of pocket. I don't go to my counselor as often as I should because of the payment. My behavior can be out of whack at home. Seeing a counselor would help my mental health. A lot of providers do not take Medicaid. This must be hard on people with developmental disabilities because many people with developmental disabilities rely on Medicaid to access their health care. I am lucky because I have Medicare. Still, I have to pay out of pocket to see a mental health care professional. Many providers are not trained to communicate with people with developmental disabilities. I experienced this when I got a new mental health provider to understand my speech. People with developmental disabilities need physical therapy, occupational therapy, and speech therapy. And it can be difficult for people to find providers who will accept their insurance. This is because reimbursement rates are too low for providers. The North Star Healthcare Work Group talked about many of these issues. Parents reported that their primary care physicians were not knowledgeable about people with developmental disabilities and guided parents toward a medical model of care. This can be problematic because parents come to believe that their children are broken and need to be fixed. Instead, the social model of care focuses on improving the society that views people with additional support needs. The North Star Healthcare Work Group will continue its work during the interim, and I hope we can address some of the concerns that were raised in the next legislative session.
Thank you, Julie. I don't think I could say it much better than that for sharing your personal experience. There were 7 top priorities that our group came up with towards the end of our time all meeting together in the healthcare work group. And I wanted to just highlight them. Some of them Julie talked about. One was a need to implement new training requirements for the care and provision of individuals with intellectual and developmental disabilities. So there needs to be, we hope, a specific curriculum or fellowship and medical residency programs for treating adults with intellectual and developmental disabilities, and funding to implement those existing models of training, and incentives to encourage uptake by family medicine providers, and look at that curriculum from all perspectives. There was a lot of discussion around the need increasing access to healthcare, and so increasing the amount of money that a person, an individual, could make without losing their Medicaid coverage was definitely a high priority of this group. A need for Medicaid rates to increase. And some of that is happening in this session. There's some legislation addressing rates federally and in Washington state, but it's nowhere near on parity with what employer-based healthcare offers. And then we have a hope to implement a TEFRA, so that a TEFRA state plan option, which I'll talk about a little bit more in a bit, that would help Apple Health to cover all children 0 to 18 years old that have a disability regardless of their DDA status. The fifth one was an intentional community health collaborative with some system trained navigators and coordinators that facilitate access and understanding of what the healthcare options are for people with intellectual and developmental disabilities. People need to be able to access the services and have someone who can help navigate the complex systems. And ideally somebody who's not being paid by the system in order to navigate the system, right? Like if your employer is a managed care organization, but your job is to help someone navigate that, it gets a little sticky. So the other piece was to require that all health information is provided in accessible formats, which means multiple languages in plain language, so that all people can understand, and then formats for the vision impaired, hearing impaired, etc. And then a need to cover specialized services. So this came up a lot in the conversations from self-advocates, a need to cover things like diabetes care, vision, dental, especially for people who needed to be sedated, mental and behavioral health services expansions, and that those needed to be considered basic health care and covered by private and state insurance. So those were some of the things that we brought forth in the group and stuff that we'll continue to work on in the next coming years. Thanks, guys. Did I cover it, Julie? Great.
Okay.
Gabriella and Ivanova, back to y'all.
Yeah, back to you,
Yes.
Gabriella and Ivanova.
Thank you. Sorry, I couldn't unmute myself. Thank you so much. I think it's so important. The services that we receive in healthcare. Please, if you have any questions for our presenters, put them in the chat, and we'll get to those questions at the end of the presentation. And hopefully all our presenters will stay until the end so they can answer those questions. Also, I'm gonna ask our presenters if you could please talk a little slow so our interpreters, so you did great, Doreen, so our interpreters can interpret as much as possible what you're sharing. That would be great. Thank you. Ivanova, would you like to present our next speakers? Thank you.
Our next presenter is Max Brown. He will be talking about rare pediatric diseases and IDD and the Born a Hero Foundation. Take it away, Max. Thank you for joining us today.
Hey, thanks so much for having me today. It's really a pleasure to be here with such an esteemed group of advocates. First, I just want to commend everyone for taking some time to engage in advocacy forums just like this. I know that change doesn't happen in Washington State on healthcare issues without people getting involved directly, and so just appreciate everyone taking some time today to do this important work. I know everybody has other things going on, competing obligations with work, family, other things. So it's great to be here with you. So I wanted to use my time today to cover a few items. One, I just wanted to provide you a quick overview of rare diseases, their impact on patients in Washington State, and the coalition that I'm a part of, the Northwest Rare Disease Coalition, that's doing advocacy work to help make positive change moving forward. I'll walk through a little bit some of the challenges that rare disease patients face when trying to access our healthcare system in Washington, and talk about just some of the reasons for us doing this advocacy work on behalf of rare patients here locally. I'll also talk through some of the legislative items that we're working on this year, and why we think those priorities will help make the changes that we want to see for rare patients in Washington. So let's just kind of start by talking about what are rare diseases, and how do they impact patients in Washington State. So a disease is considered rare when it affects fewer than 200,000 people in the US. Currently, there are over 7,000 known rare diseases, and approximately 250 new rare diseases are identified each year. Of the known rare diseases, only about 5% have an approved therapeutic currently available. You'll often hear rare patients and their families advocating for policies that encourage new therapeutic innovation, and this is why 95% of patients, of rare disease patients, don't currently have a therapeutic pathway that they can access. So about 1 in 10 persons in the US will be diagnosed with a rare disease at some point in their lifetime. And we estimate that in Washington State, there are approximately 750,000 rare disease patients. Half of all rare disease patients in the US are children. As advocates, we often focus on things like childhood interventions, newborn screenings, and other similar issues. Part of that is just informed by the number of children who are impacted by rare diseases in the US. And their needs are just as diverse and complex as the variations in their genetic codes that cause rare diseases. Rare disease patients often experience developmental delays, mobility impairments, or other critical organ malfunctions that impact them. So rare disease patients face some unique challenges in accessing healthcare in Washington State. And as part of the Northwest Rare Disease Coalition, we are a community of patients, advocates, researchers, and clinicians who are dedicated to understanding, analyzing, and responding to the needs of rare disease patients across the Pacific Northwest, and advocating for the policy priorities that improve outcomes for our families here in Washington State. And one thing that we know for sure, early diagnosis of rare disease and treatment can improve the trajectory of a rare patient's healthcare journey for the better, and result in fewer emergency room visits, less stress on the patient and their family, and save significant costs to themselves and their families over time. Unfortunately, rare disease patients are often misdiagnosed over the course of their lifetimes. You'll often hear rare disease families talk about their diagnostic odyssey that sometimes involves unnecessary and costly medical interventions. They often have to travel from physician to physician, trying to find the right specialist for diagnosis or other resources to help them understand what's happening to them or their loved one as they kind of embark on this odyssey. And one crucial final detail, the state of Washington isn't currently able to even count the number of rare disease patients in our state. And this causes some pretty tough structural issues that we face when it comes to advocating for policy outcomes that could help the rare community. So one example is in 2019, a bill was sponsored by Senator Ann Rivers that would have expanded Medicaid access to rare patients and their families. But the state's healthcare authority stated that they couldn't count the number of rare patients in Washington state, which meant that the bill died in committee. Unfortunately, the lawmakers couldn't give the bill a budget score that would allow it to move forward in the process. So the status quo in Washington state, at least according to the healthcare authority in that 2019 bill, is that they can't even count the number of rare patients in Washington. And so any policy proposal that we might put forward that involves the state expending resources to help the community just doesn't move forward because we don't have that kind of key that key kind of landscape assessment of what we need to inform those decisions by lawmakers. So as a community and as a coalition, the bill that we worked on this year, Senate Bill 5886, would have done some pretty foundational things to move us forward in this policymaking conversation. First and foremost, it would have formed a rare disease advisory council, which in turn would have conducted a landscape analysis to help answer that very foundational question for the state of Washington about how many rare patients there are in the state, so that we could in the future advocate for opportunities to improve healthcare access, even if they require the state to expend resources. The Rare Disease Advisory Council would also bring together patients, clinicians, other stakeholders in Washington who help provide for rare patients to create some common standards of care and advise the medical community on how best to diagnose and then provide therapeutic options for rare patients in Washington state. Lastly, the Rare Disease Advisory Council would have allowed us to create kind of a public website or a central place where rare patients and their families can go once they receive a diagnosis to access different resources. A lot of the challenges that rare patients face is really just even knowing, what are the steps that you take to get diagnosed and then access resources once you receive that diagnosis. Senate Bill 5886, which would form the Rare Disease Advisory Council, passed off of the Senate floor with unanimous support, which we were very proud of, but unfortunately was not scheduled for votes in the House Healthcare Committee. And so we missed our legislative cutoff deadline, and the bill is no longer active this year. We're disappointed about this, but feel really good about attracting a really wide bipartisan coalition of lawmakers and organizational supporters who care about this issue and want to continue working with us to make progress moving forward. So I will stop there, and if I'm happy to answer any questions if folks have them, or we'll defer to our organizers to continue moving us through the agenda. And thanks again for the time and opportunity to chat today.
Thank you, Max. It is so important to have these rare diseases to be counted, and also there's not only one diagnosis, so there's always a variety of conditions that affects a child or a person. So it is so important to have them counted and to have this in the legislative agenda next year, since it didn't pass this year. So it looks like great steps were taken, and we need to keep pushing forward that. So I don't know what's with myself. I'm so sorry. We have a few questions in the chat, but I think we're going to leave those questions to the end, so we give an opportunity to all our presenters. Thank you so much for being here. We really appreciate you and talking about this issue. Next, we're going to have, and actually, we have like 5 minutes. So, and I just got a message. Something about my connection. So, I'm so sorry. Ivanova, would you like to take over while I figure out something about my sound? One of the questions that I saw here is about Diana. She is asking why they don't count them. So would you like to answer that question before we go to our next presenter? Thank you.
Yeah, absolutely. And this was a real issue because other states have been able to pass similar legislation that would expand things like Medicaid access to rare disease patients in their states. And so I think our advocates in Washington were just hoping that our healthcare authority would, sort of look at what other states had done and use a similar, sliding scale or other way to kind of estimate the number of patients who would be impacted by the legislation. Basically, what they said was, we aren't able to account for the number of patients that will be impacted. We can't give the bill a fiscal note, or we can't assign a budget sort of value to this proposed intervention. And so the committee, the Senate Ways and Means Committee, couldn't move the bill forward because they couldn't, put sort of a dollar amount to the proposed budget allocation for that. So this was, I would say, unusual. We feel like other states have, been able to make these estimates and been able to, give a fiscal note that allows these kinds of legislative items to move forward. But since that wasn't the case, we believe the formation of a Rare Disease Advisory Council, one of their primary duties is to, provide that assessment, provide that landscape assessment. So when future legislative efforts come forward that require, some expenditure of state resources, those things can be considered, given due consideration and full consideration by the legislators who are writing the budget.
And hey, Max, this is Stacy Dim. Thank you again so much for coming. There's a note from a mom in the chat that she would love to join your coalition. So I'm wondering
Great.
if you could leave your information in the chat before you go, if you end up leaving. Yeah.
I'd be happy to do that. And I'm happy to stick around too.
Thank you. Thank you. Appreciate it. And I don't think we have Susan Harrell here next. Susan, are you on and you're under a different name? If not, then Gabrielle and Ivy.
All right. Susan, are you here, or do you want me to introduce Doreen?
Yeah, I think we should just go ahead and have Doreen go
Okay.
first and see if Susan comes.
So Doreen Vandervoort will be talking about the TEFRA option, TEFRA for Washington. Take it away. Thank you. You're muted.
Thank you. I got to unmute. Sorry about that. Okay. Can you guys hear me now? And is it okay to share slides from over here?
Yes, give it a try.
Okay. I'll see if I can
Hopefully.
make that happen. So first, I'm just going to show you my why. And I think that's a super important thing. Are you guys seeing the cute picture of my kids here? Yeah. Okay. So this is Damara, and she's my why. And I think it's really important always for each of us to center ourselves on the why we do what we do. And that is, she's my why. And I'm really excited to talk about TEFRA because children like her often get left out. Not unlike what Max was talking about. A Katie Beckett or a TEFRA option in Washington State would allow access to the Medicaid state plan for children who are not typically included in our DDA population. So let's start with who is Katie Beckett, right? She is a young lady who was wanting to live at home with her parents and had significant medical needs. And she was essentially, her and her family created some of the foundational legislation for our current home and community-based services programs in our nation. And so TEFRA is a Tax Accountability Fiscal Responsibility Act, okay? And that is just some fancy, super bureaucratic language that people use to talk about it. So she helped create the TEFRA 1115 grant programs, right? And that is things like our COPES waivers, and helped to birth the home and community-based services waivers, like our DDA waivers. Nationally, this was kind of the legislation that opened the door to more community-based services. And so Katie was able to go home and live with her family. And that's what we all want, right? Is for people to be able to access the supports and services that they need in their own homes or in community-based settings. So Washington Apple Health currently is so important for all children with special health care needs, because compared to private insurance, Apple Health covers more of the services and the amounts of service that is needed. Better for ongoing medical needs than private insurance, because oftentimes there's lifetime limits. There are limits to the amount of therapy a child can access. And it also gives access to like a no copay, right? So for a family who is just having an employer-based insurance option, they can pay anywhere from like $8,000 to $12,000 to $20,000 a year just to have access to that insurance plan. And then they will have co-pays, right? They'll have an out-of-pocket amount that they have to pay, and then they'll have to pay 20% towards an out-of-pocket maximum for the year, right? So for my family, before we were able to access DDA, that looked like an additional $1,500 a month minimum. I don't know about you guys. I don't have $1,500 laying around extra in my budget every month. So that was debt that we incurred for 6 years before we got onto a DDA waiver to help coverage. And I'm proud to say that 6 years later, we finally paid our last payment on that debt from the first 6 years of her life last month. And that's, I know, a privilege, right? Because I've had the opportunity to go back to work. So often we see these are some of the things that are covered by the Washington Apple Health Services Program for Children. And we offer this to families who are low income. And we have gaps, right? The government says we'll pay $6,000 a month to keep someone in the hospital that we believe would be better off at home, but the family cannot afford 1/6 of that amount to keep them at home. And that is like really the foundation where TEFRA came from, right? And that is still happening to families today, right? Because we don't fit into the specific diagnostic criteria laid out by the Developmental Disabilities Administration. We're left out because of IQ or other testing standards that don't allow people with complex medical and health conditions to be included in the disability population. And this is talking about kids. All of these people are experiencing a developmental disability because it happened prior to the age of 18, right? So Apple Health is mainly for children at the lowest income levels, but children with special healthcare needs are found at all income levels, right? And it impacts families regardless, right? And so what we see then is families breaking up. We see people leaving jobs and becoming reliant on state services in order to access the supports that they need for families. And so here's a few options, right? DDA exclusions like spinal cord injuries, muscular dystrophy, autism with an IQ above 84, neurological conditions, and genetic conditions with an IQ above 69. All of those people are currently left out of our disability population in Washington state. Not to even talk about the folks that Max and his families are trying to support, right? Because they have a condition that is not named anywhere in a big published journal, right? That could be considered under another neurological condition. So all of these folks are not allowed to access services, even though they may have significant help and support and medical needs. So options parents have been given. These are actual quotes from people in our state that have been given to them by systems folks. You can quit your job or take a lower paying job. You can ask for lower wages or work less hours. You could divorce your spouse and live in separate households. You could move to another state. There's other states with better options. You can apply for a DDA waiver, wait up to 10 years due to caps and strict eligibility criteria, or maybe never get DDA. You can put your child in an institution or a facility, even though you'd rather care for them at home with support, or you can give up custody and give them over to the DCYF Children's Administration System. These are the options being given to families with people with intensive and complex needs who don't meet the strict criteria. Okay, this is the thing. These are things said by systems people to family members. So what's the benefit for the state, right? We cover children with significant disabilities. It's likely to be more cost effective over the long term because routine preventative care and early intervention is less expensive than catastrophic acute care, which is what our system currently is doing, right? We are waiting for people to sit in the hospital for 30 days or more before we give them access to Medicaid. And this is an absolutely ridiculous expectation, right? Because what we're saying is we prefer institutionalization and high cost, expensive hospitalization to providing preventative support for families and people in their homes. And it's just absolutely, it blows my mind. It lacks logic. So allowing children to have services at home instead of an institution or hospital setting actually saves the state's money. For example, in Kansas, the average annual cost per child receiving institutional level services at home is $12,900 compared with an institutional cost of putting them in an Ashley house or an RHC, which is about $25,600. So you can look at other states to get some cost comparisons. The problem here is that we don't have good data coming in about ER usage. We don't have good data about how many children with disabilities are out there. So who's affected? No one knows. We're not asking the question in this state. We're not asking the question, how many people with disabilities are out there needing assistance and support? And nobody is gathering that data in any kind of organized way so that we could get a fiscal note to talk about what this would be. So the Healthcare Authority has said that, DDA has said that, the Children and Youth with Special Healthcare Needs Program has said that, and our hospital systems have said that. There is no centralized place that this information is consistently being reported. We're going to work on that this year. So options for Washington, the TEFRA option. We can add a Medicaid state plan option that allows anyone who meets the federal definition of a disability, that's the federal definition, not the state definitions, to access Medicaid and get community first choice. That's an option. They don't like that option because it sounds really expensive to them. Okay, so another option is a Katie Beckett waiver, right? And these are implemented in other states. This is one of those 1115 waivers, like a COPES waiver, right? And it allows them to choose and cap, right? So we could start getting an idea of who's out there, right? Who is out there in the world wanting this service? So our goal this next year, and we have a sponsor, Senator Conway's agreed to sponsor in the Senate, and we'll work on building some more support around this. I know Max and his team, we just met each other like a month ago, and we're definitely going to be good friends in this next year, North Star and healthcare access. Because we really want to make sure that this could happen. And we're going to aim for 1,000 spots for the first time and see what it would look like when we remove the barriers of all the DDA, eligibility rules. What would it look like and how many people would ask for the services and support so that we can give the legislature an actual idea of who's out there. So that's going to involve all of us, right? Making sure that everybody we know who's a friend or a person with disability who has children under the age of 18 is asking so that we can get a sense for who's really out there needing and wanting a service. So the child could be eligible if, like right now, if they meet Social Security criteria for disability, right? They can get supplemental security income if their family stays at the poverty line or just above the poverty line. They can still get CFC services in their home, right? Not that that's offered to most kids. And the wait lists are very, very long. So the access to that is limited by the staff available to deliver that assessment. The things that they're going to look at is that a doctor says that they need a level of care. It's not going to be just based on assessments or some eligibility person. It's safe for them to live at home. That's their medical providers have to say that. And caring for them at home does not cost more than caring for them in an institution, which we all know it's much less expensive. Margaret Lee, yes, Diana has these PowerPoint slides. I believe they'll go out to everybody. And the difference for your child would look like this between a Katie Beckett and a TEFRA option. So the waiver can be limited to certain disabilities, geographic areas, ages, and the state can limit the number of slots through a waiver. Waiver can offer extra services specific for children with special health care needs, right? So we have aggregate services, respite care under our DDA waivers, right? So Katie Beckett can offer those additional services. A TEFRA option is open for everybody, but it could just be medical or just medical and CFC, Medicaid in-home personal care. So those are, you know, the two options and what the different ones can mean. Currently, the state isn't really looking like they're willing legislatively to look at the TEFRA option because they can't, like Max talked about earlier, get a sense for how many people are out there and what it would cost. So they want to start with a waiver to start to get an idea of who's out there and what's available. They did a briefing in October of 2020 that is in this Google Drive, which I'll put a link to at the end of my presentation. So you guys can all access all the research and stuff that I've done about TEFRA. You can look at the background on what these look like and what waivers look like in other states. So 22 other states offer Katie Beckett or TEFRA options based on these types of criteria. Some have completely open systems where anyone with a disability can get Medicaid. Others have a waiver program like Katie Beckett, specific to medical needs, specific to autism, specific to rare conditions. They have, you know, different waiver populations. And some states like Minnesota or Tennessee, they charge a family a premium based on their income, sliding scale. You know, I'm not a person who's unwilling to pay something for my Medicaid. Like, I'd be happy to pay a monthly amount, right? Because I'm a person, my family is able to afford that, right? In order for that program to exist. And I think that that's a reasonable thing for most families who can afford that. But it's about the access and the choice, right? That we're not even giving folks in our state right now. So these are states that offer Katie Beckett. I had to add Tennessee because that was in 2019 and this is from 2017. So you can see that it's offered, you know, in many Midwest states, some on the East Coast, in the South. Georgia's beating us, y'all. They've got Katie Beckett. Tennessee's got Katie Beckett. I don't know. So in Minnesota, you can kind of see, and you guys can look at these slides. I don't want to go through all of these details, but this is just some comparison charts, and you can find all this information on kidswaivers.org, which is where I grabbed all this info from. And you can look at the different waivers and what's offered in different states and compare, you know, what it looks like. Minnesota and Alaska have no waiting list. They do intermediate care facility level of care, nursing facility level of care, or hospital level of care, which means the same level of care somebody over 18 has to qualify for to get into the home and community-based services system would be the same as what it would take to get into the DDA system as a child, right? And the spots are unlimited, right, in these states. In other states, there's income limits, right? Or there's rules around like Social Security income requirements. So that's similar to the CHIP program we have today here in Washington, okay? And we're looking to expand that. Oh, Diana says they'll all be online, including this recording. So you guys can have these slides. A child who's approved for Medicaid through TEFRA would be eligible for the full range of Medicaid covered services. So everything that Washington State says that we cover on Medicaid would then be covered. And because of early periodic screening and determination, that would allow families with children with disabilities or special health care needs to access therapeutic services and interventions that were medically necessary to the level determined by their providers. And if the special needs services, which are available only under a home and community-based waiver, they have to apply, be accepted into one of the waiver programs to receive those services right now through DDA. So what's next? We're increasing our knowledge. Everybody's learning stuff today. I'm going to keep doing this. I will give a presentation to any group anywhere about this that wants it. We're going to keep talking to our legislators and keep engaging in public policy work. We've engaged with the North Star team. Stacy and the ARC and I have been talking about this for 2 years now, or 3 years, because I was live in person when we figured out we were on the same track trying to get better access for people. So we want you guys to share your story, right? We want you to tell us, like, if you meet families, you know, people who are experiencing denial to DDA. I just met a family of a 14-year-old who had a spinal cord injury, totally, completely paralyzed from the neck down, just got a DDA denial. Total care on a trach, cannot access a waiver. I don't know what state we live in that says that's not a disability. I'm blown away still. So share your stories, write to legislators, develop personal connections with the policymakers in this off season, because we're going to be looking for sponsors. And this is not going to be cheap. This is expensive. This is a big expansion. It's going to cost money in staff and in access dollars. But there's federal match for it, so that's good news. And we've talked with DDA and Home and Community Services and Healthcare Authority folks, and they're like, you press the legislation, we're all for it. Give us more people to do good work. They know that there's families out here that want services and could access them, and that they're not able to serve. And that's it for me, guys. Thanks. If you have questions, I'm open.
Thank you so much, Doreen. Can you hear me now?
Yeah,
hope
I
it's
can hear you good.
Okay, sorry about all my sound issues. Thank you so much for speaking to such an important issue. And just to let know our audience right now, and the plan that we worked with the DDC last year to have implemented for the next 5 years includes this, includes to have services for all people from birth to death that they have a disability and don't qualify for DDA services. So this is such an important issue, and yes, we need to share our stories and do advocacy for this very important issue. Thank you so much for being here. And yes, the presentation will be posted online, and also the recording of this meeting. Thank you so much for sharing that, Diana and Stacy. We are, I believe we have Susan in the session. Is that right? Yes.
Yes, I'm here.
Thank you so much, Susan, for being here. I'm gonna let you take it over. Susan is healthcare for workers with disabilities. Sorry, and so please take it away.
All right. I wasn't really sure what you might want for healthcare for workers with disabilities. That's our Apple Health Medicaid buy-in program. And so I have a basic presentation that I can go through, but I'm really open to questions as well. So if you want to, put questions you have about it in the chat box, I'd be happy to answer them. And if this is okay, if this is what you're planning, Adrian, I'll just start into a brief overview. Does that sound okay?
I think that sounds great. And also, if you have any questions from the presentations that we have heard, please post them in the chat, and we are going to address them at the end of the meeting. So we have all our presenters share. And thank you for being here, Susan. Thank you, Doreen, for such a great presentation as well. Thank you.
Thank you.
Hey, Susan, just want real quick too, can you also just give a plug for benefits planners and how that plugs into your work? Thanks.
Yes, I have it at the end of the presentation. I have a link to being able to access those things. So, all right, here we go. Let me share and start this PowerPoint. And there, can you see that okay? All right. So I'm here to talk about Apple Health for Workers with Disabilities, but I actually work at WISE. I'm the Assistant Executive Director there. And I've also been rolling out a new project for benefits planning for people with developmental disabilities and actually framing it as a service that is a one-stop where people, there is no wrong door. You don't have to be eligible for DDA services to access our service center to be able to get connected with a benefits planner. However, for those people that have DDA services, they are able to, and they can even be on the no paid services caseload, they have access to benefits planning. So that's in-house that we have through our contracted planners. So Apple Health for Workers with Disabilities has been a really, really good program for folks that are making more and more money as time goes on, as we're achieving better outcomes in employment, and they still need the Medicaid waiver supports that they get on their job or in their home and in their community. I can remember years ago, this was first introduced in 2004. I've been around a very long time, worked in the field since 1985. And when this rolled out in 2004, I was so thrilled by it, but it didn't offer people on the waiver eligibility that was maintained if they went and did this Medicaid buy-in. And in Washington, we shifted that so that Apple Health for Workers with Disabilities was one way that somebody could say, I'm eligible, I have Medicaid already, and it's a kind of Medicaid that helps me qualify for waiver services. So I can still get those in-home and community-based and employment-based supports. And what has happened in recent years is it's been further transformed, because that victory in about 2007 to include the waiver as an eligibility population for our Medicaid buy-in was exciting. But the income limits kept being a problem. So I get calls from people saying, I'm making a lot of money and all of a sudden I'm at a risk of losing my Medicaid waiver eligibility because I'm making so much money. Even if I'm using our Medicaid buy-in program, that concerned me a lot. And I actually enrolled a variety of people within the community to provide information to legislators, like folks from Microsoft and CBRE, from the employer perspective, wanting to pay people more, people like Darla Helt and Kathy Murahashi to come and talk about the way in which they envision their children being able to maintain eligibility as they grow into bigger and better income from the outcomes they receive from employment. And then also people who benefit directly, individuals who benefit from healthcare for workers with disabilities. So it was a small but mighty group. And the changes are super exciting because what resulted is that the fears that people have about the loss of Medicaid, even when it comes to our Medicaid buy-in, or how they have to stay low income and be concerned about their resources, we were able to get the legislators to agree that we should get to a place where our Apple Health program now offers Medicaid that is not based on any income limit. So you don't have to be under a certain income to be able to access it. There is no resource limit, which is part of the original Medicaid buy-in program. So you can have Medicaid and you don't have that $2,000 resource limit. There is no longer the upper age limit. Used to be that you could only, it was for people that were between the ages of 16 and 64. Now you can go well beyond 65 and continue to maintain Medicaid through this Medicaid option at higher income levels. And there's some additional options I want to discuss briefly as well. Now, one of the things that's a sticking point for people is that they're not used to paying a premium to receive their Medicaid. And if you go through this Medicaid doorway in order to have those no income limits, no resource limits, what's going to happen is that a premium is typically applied. Now, during this pandemic health emergency period, nobody is paying premiums for our Medicaid buy-in, and that will continue until the end of June. But after that, the regular premium may come into play. And that is a premium that is based on the type of income you receive, but it can't be any more than 7.5% of the total monthly income that a person has. Now, I say 7.5%, and I want you to imagine that if I make $1,000 a month, I'm going to pay $75 at a maximum for a premium for healthcare for workers with disabilities. But the thing is that people who are earning most of that money, like somebody that has a job and they don't have any other income but the income from employment, their premium is actually adjusted down to $25 for every $1,000 they earn, or 2.5%. So it's arranged, or there's an array of premiums that are applied based on the kind of income that somebody receives. And if you ask me, that's a pretty low cost option. Even in my employment, if I wanted to cover my child, I'd be paying a lot more than that in premiums to be able to get my private health insurance to cover my child. And the Medicaid options that people get when they are on a waiver to be able to support them in their homes and in their jobs are things that you can't even get from private insurance, right? It offers so much more. So when people are really worried about it and they're trying to limit their income in order to stay eligible, or limit their resources to stay eligible for a different Medicaid group, it's really a shame, because the premiums are not that high. And they're limiting their income to grow well beyond where they are across time for fear of paying a premium, or limiting their resources same way in order to stay eligible, when they wouldn't have to go through that if they just would enroll in this program. And just a caveat, I don't work for HWD. I'm not trying to get more people there because, you know, it'd be good for my business or something. It's because I think it is a remarkable program to help people have lives that reflect what the rest of us think are so important. You know, retirement plans and being able to have money to go and do the things that you want to do, and yet still get the things you need in terms of the supports in your community. And so the other thing that I would like to say is that these things that I'm talking about, the no income limits and the no resource limits, they are unique to HWD. There isn't another Medicaid program that's going to give you the Medicaid coverage of a waiver and provide you with that kind of robust offering as far as the no limits piece of it. It's really unique. It's available to anybody that's 16 or older. If they are working, you have to be working or pursuing work in order to maintain HWD. But you don't have to be under the age of 65 anymore, because that has been left behind with these recent changes that our legislators supported. One of the things that I want to mention to you is sometimes people are worried that if they get on HWD and save a bunch of money in a private account, that if they lose their job or decide to quit working and they need another Medicaid program, they could have a hard time with the resource limit being 2,000 with those other Medicaid programs. But a piece of the legislation, a piece of what was passed, is that as long as people are saving earnings from income in a totally separate account, and they let that build beyond the $2,000, that account will be excluded for counting as a resource when they transfer to any other Medicaid program. So there is a way to even exclude what you save while you're on HWD when you decide you're ready to retire and don't want to work anymore. It's really an amazing and unique, and I think innovative offering that we now have with HWD. I see that Adrian has a question.
Hey, thanks, Susan. I'm just wondering about that account. Would it be subject to a Medicaid sweep?
The dollars that are saved, would it be subject, in other words, to that estate recovery that Medicaid programs have? That's what you're talking about. And really, any resource that somebody saves that is of their own money when they have a Medicaid program could be subject to that when it's their own money. So understand that in trust, when you have a third party putting money in, that may not be the case. But when it is your own money, it certainly could be subject to estate recovery. And people are quite concerned about this with Medicaid. I want to give you a few provisions around that, though. When somebody is receiving Medicaid and they pass away, some of the cost of the services they received through Medicaid may be recovered after their death. And the time that starts marking that is services they receive when they're over the age of 55, typically. There's different provisions around the timeline, but typically for long-term care services, it's for people over the age of 55, the services they receive during that time. And even ABLE accounts are subject to estate recovery. Money that an individual saves in an account, even lottery money that I get, the things that I have that are available as dollars to be able to attribute to my own savings are things that could be subject to estate recovery upon my death. There are some exceptions, and I think it's worthwhile to think about doing a very specific presentation about that. But these dollars would be as well. We wouldn't be able to get an exclusion of that form. Our state had to go to CMS for this exclusion from counting it as a resource on transfer. I know that they wouldn't exclude it from estate recovery, at least not at this point. Maybe we can do something about that in the future. Did you have another comment, Adrian?
Not for right now, but we need to do lunch because I just always learn so much from you. Thank you.
Yeah. So here's the thing about HWD eligibility, and I want to tell you what I tell families when I'm talking about HWD. A person, when they apply for healthcare for workers with disabilities, must be working. It is a work incentive angled program. So you must be working at the time of application. And working is really defined as making money that is reportable to the IRS. So it's taxable money. Doesn't mean I have to pay taxes on the dollars I earn. Like I might have earned income tax credits where I actually get the money that I am being taxed back each year. That's always a possibility, but I'd still would qualify for HWD. What they're trying to address is that people can't just be making money under the table and count that as a work effort when it comes to this program. So you must be working at time of application. And then every year you're going to be reviewed for qualifying for the program, and they're going to see if you're working again on that anniversary date. So if I apply for HWD in April, and I'm found eligible, then the next April, when I've been found eligible, they're going to be looking to see if I'm still working. And this prospect is one of the things that I want families to plan around, which is, okay, what happens if you lost your job just a few weeks before your anniversary date? What are you going to do then? And I really recommend to families that they think about a backup job, even if it's like selling Avon or, kitchenware, or that they have a family member that has a business that can employ the person for an hour or two a week for a little while another job is being sought and the person gets into a more full-blown employment situation. It is the one thing about HWD that can really be a sticking point for families, and I want them to be prepared while they're going in to think about supports to assure that individuals are able to have to meet that requirement on an ongoing basis. And I really believe that providers of employment services need to know that as well, that they need to really do what they can to snap to make something happen if a job loss occurs and the anniversary date is looming for HWD, because employment is a requirement. The other thing that people need to know is that you have to qualify under the Social Security definition of disability to a certain extent for HWD. And what that means is that you don't have to be on Social Security, but you may have to go through a disability determination process if they can't identify that you meet the definition of disability. The one exception is that a person doesn't have to be working under a measure that Social Security uses called substantial gainful activity. You can work well beyond that and still be eligible for HWD. And you could even medically improve. Like if I applied for HWD and I was considered to have a disability that qualified under the Social Security definition, and then I received treatments and I ended up improving to a point, like medications or therapies or other things, I ended up improving to a point that Social Security didn't think I was eligible any longer under the definition, or our state's disability definition didn't think I was qualified under that definition. I could still maintain HWD under a medical improvement group. So there are some exceptions to even the rules around meeting the definition of disability for HWD. And the final thing I wanted to share, because I know my time is brief with you, is that there are some resources to apply for HWD. You can go to that washingtonconnection.org site. And if you want benefits planning or even more information about HWD, you can go to the benefitu.org site. And if you want to apply for services, the link here is telling you what our service eligibility guidelines are and also allowing you to book an appointment. Now I'm going to share this PowerPoint. You can let me know who to send it to, but that way it'll be distributed and available to you. But Benefit U isn't the only place you could get information. You could go to Plan to Work or Plan for Work. I put what areas they cover in their contact information here. And also, if you're with VR, if you're with a division of Voc Rehab and get services from them, you can also ask for benefits planning from them. So we really have a lot of options for people to get more information. But of course, I'd be happy to provide information now or anytime that you have questions. I can direct you to trainings that we've done and handouts that we have available. So thank you for having me. And I know it was a short amount of time. I hope that what I've described is something that people are able to digest in such a brief presentation. Are there any questions for me?
Let's see if there's any questions in the chat.
We are gonna take all the questions on the chat. So we have our next presenter to come on and share. And at the end, you guys will have the opportunity to answer those questions.
So
Thank
do you
so
want me
much
to
for
hold
Susan.
tight? Do you want me to hold tight then for a little bit here?
Yes, please. Thank you.
Okay.
Thank you so much for being here.
Thank
Great
you.
presentation. Thank you. And if you like to share your contact information in the chat so people can have a way to reach out to you, that will be great, Susan. Thank you. Go ahead, Ivanova.
All right, thank you so much for presenting. Let's just check in the chat if there's any questions. Sean says, oh, okay, never mind. Doesn't look like there's any questions for this in
No.
the chat, at least.
We're gonna check them at the end. Thank you,
Okay,
Ivanova.
sure. So I will introduce the next speakers then. Our next speakers is Ramona Hazendorf and Mike Gatella, and they will be talking about the personal needs allowance in Senate Bill 5745. Thank you, and take it away.
Hi, this is, oops, sorry, I got my cover on. This is Ramona. It's my co-presenter here.
I think Mike's not here. Ramona, you might be covering it for him. Mike
Okay.
did send his testimony that he submitted on this bill, and I bet we could post that on our website along with this recording. So we'll just go with that for now.
Okay, all right. So I won't take very long. It's pretty straightforward. Well, if you read about it, it's pretty straightforward. It may not be straightforward at all if you just look at the bill page. So there's a bill out there. It's called Senate Bill 5745, and it covers something called personal needs allowance. But it's for personal needs allowance for people who live in their own home. So not necessarily in an adult family home or assisted care living. So to back up, some people get long-term benefits through Aging Long-Term Support Administration, and that pays for personal care. Some of that money they get to keep, and that has to pay for things like rent, food, electricity, prescriptions, anything they need for their personal care outside of anything they need to cover for their personal needs outside of personal care. And the problem is that in Washington, we don't get to keep very much. And it's really hard for people who are just living on their own and getting this personal care coming to them. It's really hard for them to pay their bills. As far as I can tell, this would not apply, this increase they're talking about would not apply to somebody in an adult family home or a listed assisted living facility. This is for people who just live in their home, just a regular home. And so what they're proposing is to really almost double it. Like right now, they can only keep a little over $1,000. And again, that has to cover their rent. I mean, all that stuff, your food, all that stuff. And so what they want to do with this bill is they want to more than double it. So that if you are a single adult, you could keep back $2,382. That's more than double. And again, so this would pay for the rent and their food and electricity and their cable, their internet, all that stuff. And if you're married, it's more, it's a $3,573 for a married couple. So that's a really big increase. It passed through the Senate very strongly. There was only one vote against, which was, I don't know what his rationale was, but Mark Mullet in the 5th district was the only person who voted against it, but he voted against it. And right now it's on the House side and it's in the rules. So hopefully it will come up for a vote. So this won't affect everybody who has a personal needs allowance, but it will affect people who live on their own, who get personal care that comes to them, and who are struggling to pay for rent and food and all that. That's all I have. Thanks, everyone.
Thanks, Ramona. And I just received word that it sounds like Mike Gontal is not feeling well, and that's why he's not here. So we wish him well. I hope he gets better soon. Ivanova, do you want to take any questions from any of the guests or from the chat?
Right. So in the chat, we see there's a link for more information about 5745. So if you want to get more information about that bill, it's right there. Now, I'm going to change my view so I can see if there's any hands raised. Let's see. Okay, I don't see any hands raised on this. And I don't see anything in the chat. So, if there's no other questions, would you like to move on to the next presenter?
Yes, thank you, Ivanova.
All right, so the next presenter is Adrian Stewart, who will be talking about the North Star wrap-up, and she is from the Washington State Developmental Disabilities Council. Take it away, Adrian.
All right, thank you, Ivanova, and I will take it away. Well, actually, I'm just going to reflect back to you and our incredible group of advocates about the healthcare work group and some themes that emerged from that you've heard already today, and then also just give a kind of a general overview of the North Star work and next steps. Again, I'm Adrian with the Washington State Developmental Disabilities Council. I have 2 kids with developmental disabilities, and I also have a twin sister with developmental disabilities. So I come to this work with that lived experience, and my background is also in organizing, and I'm a trained attorney as well. And so when I sit down to, I feel a lot of honor when I sit down and hear families share their healthcare struggles, and people with developmental disabilities share their traumatizing experiences within the healthcare field. I've lived those myself as well. But I also want to highlight and elevate the marginalized groups within our communities who are disproportionately impacted by bad medical care, and also racist medical care, and medical care that's can be steeped in and has a history in eugenics. In our conversations in the healthcare work group and the North Star, we talked not enough, but we did talk about the disproportionately poor impacts and outcomes that people of color experience in general in the healthcare system. And then layer in on top of that, the barriers that people with developmental disabilities, who are also people of color, experience. I think it's important that we remember these issues when we're talking about healthcare. Healthcare access, especially for people of color and for people with developmental disabilities, hasn't always, still isn't now. It's not the same, right? If I go and sit down in front of a provider, I'm taken seriously. I don't have language barriers. There's a presumption that I'm being truthful, that I understand and know my body. And those are things that I take for granted when I sit in front of healthcare professionals. I also want to talk a little bit about the definition of access. Just because a person can drive to a hospital, just because a person could, walk into a medical clinic, that's not access, right? When I go to a doctor, I expect to sit down and have there not be any language barriers. I expect to be treated respectfully. I expect that I will be believed when I say that there's something wrong with my body. And I just want to acknowledge that that isn't the case for a lot of people in our community. And I just want to elevate those conversations and those threads that happened in the North Star work group, and say that I'm committed to continuing to make space for those conversations moving forward in whatever space I'm in. We also have some of the issues that came out of the North Star work group that I thought were significant to address here include the fact that for some people, for some insurance, for some Medicaid providers, they require talk therapy before they will prescribe psychiatric medications. That was a huge issue of concern that came up in our group. And if you've got a person who is non-speaking, but still requires psychiatric medications or supports, antidepressants, whatever, that can be a barrier to access. And that's a real struggle as well. I want to pull on the theme that Julie also brought up about accessing mental health care. We've got a lot of people in our community with developmental disabilities who also need access to mental health care, and co-payments can be a huge barrier for people, especially if somebody is living on the margins and doesn't have the means to pay for those co-pays. So I want to highlight that as well. A previous presenter, Max, I think brought up a really important point about how the legislature has typically dealt with our issues, and that it seems to be, for me at least, one of the ways that it is handled is they just don't count us. And I've had at least one legislator, a very popular legislator that everybody would say is supportive of our community, tell me verbatim, Adrienne, if we count your people, then we have to pay for them. And so I just want us to make no mistake that not counting people in our community, not counting people with rare diseases, is an overt way of saying you don't matter. We don't want to prioritize you in the budget. And so we have to get organized and make sure that we're holding legislators accountable on these issues moving forward. Obviously, Max talked to people in other states, and we have too on similar issues, who got creative and extrapolated the numbers to come up with some sort of budget forecast. And so where there's a will, there's a way. And as a community, we've got to work together to create the will in the legislature so that there is a way for our community to be counted and to be prioritized in our state's budget. Okay, those are my healthcare notes and themes I wanted to pull out. I just want to say very briefly, I want to give a lot of gratitude to Diana Stadden, who has done an incredible amount of work in organizing each of these advocacy days. A lot of work that goes on is behind the scenes, and you just need to know as a community what an incredible advocate and resource we have in Diana. So I want to give space to thank her. I want to thank our current co-chairs of the North Star Advocacy Group in general. Priya Jayadev and Kyle Matheson have done a ton of work to get us through this legislative session. Legislative session ends next week. And so I'm also really grateful for the advocacy days kind of following the themes of the North Star work groups. We'll love your feedback to see how you felt that went and how that worked for you. I do plan to send out a survey toward the end of March to understand what worked for people with the North Star work groups and what didn't, how we can refine and tune up and get our advocacy to a elevated level to go into next legislative session, because we're already thinking about and talking about planning for the next legislative session. I also want to thank Julie and Doreen for their incredible work on the healthcare work group. They are real experts with a lot of subject matter expertise and lived experience. I'm so grateful to each of the presenters today. So that's all the time I'll take. Thank you all so much, and I'm happy to answer questions.
Thank you so much, Adrienne, for speaking about all the work that goes behind the scenes for advocacy and for all the issues that we have for people with disabilities in the state of Washington. And yes, thank you to Diana and Stacy for all the work that you guys do behind the scenes, and for all of you that have taken action signing pro in the bills of interest, and also for your testimonies and for all the support and your stories, because without them, none of this work could be moving forward. Thank you so much for all of you and for the advocacy and the leadership that you guys all take. And yes, if there are any questions for Adrienne or any of our speakers, this is the best time to ask those questions. And let me change my view to see if I see any hands raised. I don't see any.
Gabrielle, I just noticed a really nice comment from Melinda Young Flynn from the Budget and Policy Center in the chat. And I don't know if you want to go ahead and read that.
Let me see. Can you see it? Can you read it?
Yeah, I can actually.
I'm looking for it.
I'm
Okay.
I'm happy to share. Hi. Sorry, I have a loud dog in the background, but I'm with the Budget and Policy Center, and I had just wanted to make sure that folks on this call knew. I'm sure lots of you do, but in 2021, the legislature did pass the Working Families Tax Credit for our state. And so starting in 2023, for about 400,000 Washingtonians are going to qualify for an annual tax credit of up to $1,200 a year per household. So I'll relink to an article about it and share my email if people have more follow-up questions.
Thank you, Melinda. Yeah, this is it's great information. And okay, now I see your message. And yes, if you can go to that link that she's providing, and this is great information. Do we have any other comment or question? Let me see. Yes, and so she posted on the chat that link for the budget. So it's $1,200 per household, correct?
Up to 1,200, depending on family size and other eligibility requirements. And also ITIN filers, so people who file taxes without a social security number will qualify. Yeah, and I'll share a couple fact sheets too. We have them in different languages for folks, but the fact sheets were when we were advocating for the policy, but it will give more information around how it's going to work.
Yeah, that sounds great. I'll reach out to you and get those in different languages. That will be awesome. Thank you. Do we have any other comment or question? Go ahead, Doreen.
So I just put a link in the chat that is an update from the Washington State Healthcare for All Washington group. And they're using an initiative process and a few other things to try and create universal healthcare here in Washington. But they need, and I think, you know, after being out to a couple meetings, I would love to see more disability voice and Medicaid population voice as a part of those conversations. They really haven't thought about us because we were not at the table as they were beginning their thought about healthcare for all, right? They're like, oh yeah, with the Medicaid population, they're taken care of, right? Which we hear a lot in the world as they think people with disabilities, you're covered. We know that's not true. So they were surprised, you know, by the information I brought forward around Katie Beckett and the limitations to access for people with disabilities in our state. So I just think it's important for us to be sure that we are bringing our voices also to these larger tables as a traditionally marginalized group of people, you know, and continue to like stand in that gap for those of us that have the agency and the freedom and the knowledge, right, in the work that we do to bring our families' voices and to get self-advocates supported to come to those larger policy tables that are trying to impact healthcare for all Washingtonians. But I put their legislative update and some of the bills that they've been working on for this year, which will impact people. It includes a prescription drug affordability board, insulin affordability, reauthorizing total cost of insulin work groups, cost sharing for prescription drugs for all enrollees in Washington state, freedom of choice for pharmacy, spending on primary care, and increasing the requirements for healthcare systems to offer charity care to every family who could potentially, every person, every Washingtonian who could potentially qualify for it. And then talking about the increase on Medicaid expenditures. So you can see that they're working to create a Medicaid expenditure forecast work group. That's a bill that they did. So some of this stuff impacts our population, but I don't see a lot of disability voice in the planning. So in the interim, I hope we will, you know, bring some of this great work that we're doing in all of our organizations to those larger tables to impact the bigger policy agenda of Washington. Thanks, guys.
Thank you, Doreen. And yes, I see that Eric has a question, and yeah, let's remember that we need to continue the advocacy and activism for all these issues to be moving forward. And if something didn't pass this session, to be prepared or starting getting ready for next year, to keep pushing on all these issues to be counted and to have more providers and for the amount of money that each person will make and without losing the service. Go ahead, Eric.
Thank you. I have a comment. Basically, I want to thank all the advocates and everyone during the advocacy days for their great leadership and stepping up. You all do great work, and a huge thank you to the ARC of Washington and the co-chairs of the North Star Project, and happy to be a part of a great team of advocates, all for the right reasons.
Thank you, Eric. And with that, we're going to go to Stacy for the bills of interest.
Thank you, Gabriella. And we have a lot of love in this room. I am feeling it for sure. And I'm so grateful to all the work. This has got to be one of the best advocacy day sessions that we've had, I think, and I've been coming for at least 10 years. So I'm just so grateful to everybody's information and willingness to step in. Zoom has definitely opened up a lot of content for us. So I'm going to proceed with basically looking at the bills of interest here. And I'm going to share one quick thing. So our bills are doing really well right now. And there are a number of things. I'm sorry, my internet is just being fussy. So I'm going to pull this up really quick. There are a number of bills that right now need to be pulled from rules. As most of you know, hearings are over. So we are now in the phase of pulling bills that have passed from rules onto the floor, and the legislature is going to spend the next several days on the floor trying to pass bills. At the same time, there'll be a conference on the budget. And so both the Republicans and the Democrats will pick conferees. They'll go into conference and they'll reconcile issues in the budget to see what will be final. So there are two ways that you will be advocating this week if you care about some of these bills. Our top priority this session has been Senate Bill 5268, which provides for a full-time caseload forecast counsel position that would just look at the needs for developmental disabilities. This bill did not get as far as we really wanted it to go. We had pushed very hard to make this entitlement caseload forecasting and to really get the legislature to commit. So what the end result is here, we want it to pass, is that we set up the scaffolding, really, the mechanism for us to get all that great data that we talked about today. Data is so critically important because without that information, the legislature is not going to fund our services. And that's what 5268 will ultimately help us do. 1980 is also a bill that we're very excited about that will allow for dual services. So people may choose to participate in supported employment and day services, and they won't have to choose one or the other. In addition, we have a Senate Bill 5790 that establishes school to work across every county so that it's equitably available, not just in the big wealthy counties, per this really great transition collaborative report that happened about 2 years ago. That's been was a report that was required, and a lot of great work has gone on between DDA, DVR, OSPI, and the counties to ensure that we have more access to that program. House Bill 2008 takes away DDA's ability to use IQ as a cutoff for eligibility for DDA services. And this bill has had quite a journey. It is ripe, ready to be pulled and up for debate on the floor. And then there are a list of several other bills that I'm not going to go through specifically. Senate Bill 5745 was one that we went through today. 5376 is on requiring public schools to inform families about OEO. And we have one on property tax, language access, and establishing a housing advisory committee to maximize housing for people with disabilities. Important to DDA is also a no paid services caseload bill. So these are some bills that are waiting to get their day on the floor and be voted finally. And so I hope if one of those is of interest to you, you'll contact your legislators. I'm going to take 1 minute to go through the budget provisos that are top priorities for us. Most importantly, we want to make sure that there's funding to support Senate Bill 5268. We want to make sure that the Senate number is used. And that's the 192,000 number that was assigned to the caseload forecast in the Senate budget, and that gets in the final. You might mention to your House numbers that we really need them to support. this number. In addition, we want to make sure that the proviso around reducing the footprint at Rainier is in the final budget. The House did not include this proviso at all. We want to make sure that we're moving forward on changing the way that we use services, and we have fewer and fewer people who need to be at Rainier RHC. And then the last proviso is that we ensure supported living gets the wage increase that is supported in the House. That was the best livable wage at $20 an hour between the two chambers. And we want to make sure that we support our direct support professionals in supported living. So does anybody have any specific questions about those budget provisos or those bills that we're anxiously awaiting to be pulled from rules onto the floor? Okay, well, I hope you'll all watch for action alerts on making sure that if there's something in danger of not making it out, you'll be able to contact your legislators. And we're really grateful for all your advocacy.
We have a question from Carrie
Hi, Carrie.
and Darla next.
Carrie, you're on mute if you're trying to talk.
There, now can you hear me?
Yeah, yeah.
So I wanted to ask Stacy, so we can see the new language in 5268, or how can we find out just what that bill is now about? I'm not sure I understood. Is part of the bill gone and new language was put in? Or can we go to the page and find under 5268, we can see what the new language is? Or how the bill is stated now? I guess that's my question.
You can. It's a longer bill. Be easiest to go to the bill page and look at the version there.
Yeah.
Were a couple of amendments put on it so that if 5268 is not adequately funded, it will be null and void. And we definitely want to make sure that it's funded. And, you know, our hope was that we were going to add to the bill. So the amendments that we were hoping for would remove the word courtesy and would make caseload forecasting an entitlement. And we were not successful in doing that this round. But we still need those courtesy numbers because, as we've been saying all day, we need to have that data so that the legislature will fund us.
Okay, thank you.
Yeah, Darla?
Hey, Stacy, could you email me that sheet you just had up? I need to present this information to multiple counties this afternoon, and that was very nicely done. Thank you.
Yeah, absolutely. And the bills of interest is also on our website. I apologize that I cannot get that to pull up for some reason right now. All right, any other questions about bills or provisos? This is it, March 10th, it's all over. So this will be our last advocacy day and our last chance to kind of get together on some of these things. So if you have any questions, Adrienne and I are both available 24 hours a day. Just shoot us an email. And
Stacy, I'm not able to raise my hand because I'm a co-host, I think.
Yeah.
So I just keep blurting. So I apologize for that. I just wanted to ask, like, what is the best strategy right now for those of us that are out here, right? Like I'm seeing Diana put some stuff in the chat about writing to people. Are there specific people we want to talk about for getting these bills out of rules, right? Like, is there a specific set or group of legislators that we need to email? Should we just be looking at the action alert that came out earlier in the week? What's the best way to spend time and create meaningful action on these things?
Great. Yeah, great question. On the provide, so Diana's done an amazing job putting this in the chat, but it might be too much for people. So the easiest way would be to go on the Arc of Washington website under Advocacy and Action Alert. And that has this very message that Diana just put in the chat available. And that focuses on budget writers. So we want budget leaders to really hear about those provisos and ensure that all the budget asks that we have go through. On individual bills, the best thing to do is to look at the Rules Committee. And I don't know if Diana put that in the chat, but we can. the Rules Committee, if you know any of the legislators on the Rules Committee, to get those bills that are sort of languishing there out. They're the legislators to focus on this week. And so we want to really appeal to them. I spent yesterday emailing two legislators that I have good relationships with on rules to say, please get these bills out. And that's really all it takes, is to please pull this bill from the Rules Committee and let it go to the floor. And then this week, with floor action, if you want to know what's going on the floor, if you go to the main page for the Washington legislature, there is a floor action button, and it's easy to see each day, even each hour, what they're working on. And if you see that there's a bill coming up, you can email your legislator or legislative aide for that person and just say, you're watching, you want that bill to pass, please vote yes. And they are responsive to that. They're watching their emails and their contacts. This is the time of the legislative session that all those relationships that you hopefully cultivated before the session came to fruition, so that you have either a phone number or a text or a quick email that you can send, so your legislators know for certain this is what you want to happen. So that's how to be the best, most effective. So Diana has put in the chat the House Rules Committee. She's put in the budget leadership, and again, those are all on our website under the action alert. If you sign up for an action alert, you'll get the action alert right there in your inbox, and it'll be easy to see what's going on as well. So if you haven't done that yet, please go to our website and sign up for the action alert.
Thank you, Diana, for sharing all that in the chat, the emails and phone numbers for every representative. Thank you so much, Stacy, for sharing about the importance of all these bills, and just to have in mind that we still can reach out to our representatives and to vote yes on all these issues that are so important to our community with intellectual and developmental disabilities. Do we have any other comments or questions?
I got no comment, but everybody, thank you. Thank you, everybody, for behind the scenes, to all the presenters today, all the presenters from the past advocacy days. Wonderful information. And to please make sure you fill out the evaluation form. It helps them out. It's just go down and pick your language, and it's really pretty easy to fill out. So this will help the ARC doing their stuff for one last time. Thanks.
Thank you, Kyle. And I see that Diana says this will be posted with today's information. Thank you so much, Diana. And I see a hand raised for Margaret Lee Thompson.
Yes, thank you. Is it okay to communicate with every one of the people that are on rules, or should we just do it on people we know?
It depends on how much time you have in the day, Margaret Lee, but absolutely, yeah, they all need to hear it. You know, definitely go with the ones you have a great relationship with, but we can't ask them enough.
Okay, thank you very much.
If you see somebody who says no, then reach out to the one that voted no so they can change their position for sure. Thank you so much. That's awesome. Yeah, that's important how much time in the day you have. That's awesome. Thank you so much, Stacy, Diana, everyone, for being here, for all our presenters, Ivanova, for all of you attending this session. And if there are no more questions, we are please ask you to fill up the form with the survey for these sessions. And I see one more hand raised for Josie. And after that, we'll wrap up this meeting. Go ahead, Josie.
There's the advocacy next week, right? Or no?
No, this is the last session for advocacy days.
Okay.
We're all done, Josie.
I'm sorry. I'm sad.
We'll have more.
Okay.
Yeah, that's great. Thank you so much.
We're gonna get North Star work groups up again, so everybody just come join and like be a part of those conversations wherever you're passionate, whatever work group you want to be a part of. Those conversations are going to keep going as we gear up for the big year in the
Well,
fall. So
hopefully I
come.
see you all at sale, maybe.
Yeah, thanks, Josie. We'll get you involved in North Star so you can keep getting the stuff done. I know there's some DCYF changes you'd love to see.
Yes.
Thank you. And please don't forget to fill out the evaluation form. And we do need your feedback. Thank you, Diana, for reminding us. And with that, we are going to ask Jessica to wrap up for us.
Oh, actually, that was the wrap up. Jessica's not
Oh,
available
okay.
to be here today. And
Nope,
that was
there
the
you
wrap
go.
up.
That's it. Oh, also happy Developmental Disability Awareness Month, which is March. So celebrate in any way you like.
Well, guess what? I'm turning 42 on Friday.
Woo!
I'll
That's
be
great,
old.
Happy birthday. I see Carrie has a question.
Go ahead, Carrie.
I was just asking for Doreen's contact information, and she may have already put it out there, but I didn't see it.
And for those of you who are interested in federal issues, the Disability Policy Seminar is coming up at the end of March. There are several people already signed up on our state. Diana is the state captain, so she'll be organizing congressional meetings for people who are going to be part of the Disability Policy Seminar. We'll switch gears a little bit and look at what's going on at the federal level for our issues. For those who can't join because there is a cost to be part of that conference, we'll make sure to post all the information that we get so that you can participate in federal congressional advocacy.
How does someone get involved in that, Stacy or Diana?
The Disability Policy Seminar is a conference that you can just Google Disability Policy Seminar 2022. And it will
Hosted
pop
by
up.
both the ARC and AUCD.
I can put it in the chat. I can do that really quick.
Also, Adrian, could you share the link for people that want to get involved, or during people that want to get involved in the North Star project? So they have the link where they can request to be added to that group. If anybody needs it, I think that will be great.
Adrian, is it just your email address? How do people opt in?
I think it's only by email, but if she can post her email address so they can reach out to her and request to be added to the list. I don't see if Adrian is still here.
Adrian might have hopped off. She was, she's got some busy days ahead of her.
Yes. So thank you for sharing the link, Stacy, for that. And thank you so much, everyone. Oh, Diana, thank you for sharing the email, Adrian's email. Thank you, Diana. She's on everything. See, she's awesome. Thank you so much, Diana. Yay. And happy Disability Awareness Month. We continue advocating for our children and adults with disabilities, not only through the month, but the entire year. So thank you so much for all the work you guys do.
Thank you, Gabriella and Ivanova, for being our hosts this legislative session. You've been wonderful, just wonderful. Thank you.
Thank you. Sorry for all the sound issues.
Not at all. All right, everybody have a great week. Go send some emails to your legislators.
Yes, definitely.
Thank you so much. Really great work. It's been really great working with you, Gabriella. Thank you.
Ivanoa, it was great co-hosting with you. You are awesome. A great advocate.
I'm going to say again what somebody said earlier. I just think Zoom has been really good, where we've been able to get to know people and to see people that we've seen their names, but we had never met them. So, and thanks for all the work you guys do to put all this together. I just so appreciate it.
Yes, I totally agree on that, because it is hard to all be in the same place, you know, and Zoom definitely has made a big difference. Hopefully we continue having Zoom I'm available. Even when things are going back to normal, maybe a hybrid option or something like that, that would be great.
I just don't miss all those getting in the car and going to Olympia 2 and 3 times a week.
Yes.
Okay, take care.
I just got back from DC, so I hear you. Traveling.
Happy birthday, Courtney.
Have a great day. Great to see you all. Thank you.
Bye, everybody.
Bye.